Okay, so we're covering the autonomic nervous system. All right, so as a review, we're going back to this original diagram of the nervous system. We had the central nervous system, peripheral nervous system. We covered everything with the exception of the autonomic nervous system. That's the two neuron chain, parasympathetic and sympathetic divisions of motor output. So we have the somatic division to just skeletal muscle only, single neuron, the little single red arrow. But the autonomic nervous system is a two neuron chain. So how does this differ from the somatic division or from the nervous system? Right. Well, the ANS consists of motor neurons, right, similar to what we've seen before, but they innervate everything other than skeletal muscle, smooth muscle, cardiac muscle, and glands. They make adjustments to ensure optimal support for body activities and operate via subconscious control. So there are two systems that differ in a couple different ways. One is your targets or your effectors. The other is the efferent pathways and the neurotransmitters used between neuron 1 to neuron 2 and neuron 2 to the target organ in the case of the autonomic nervous system, and the target organ responses to neurotransmitters. All right, so let's look at effectors. Somatic division is skeletal muscle only, and the autonomic nervous system is everything else. Cardiac muscle, smooth muscle, and glands. The pathway, well, the somatic division is a one neuron, very thick, large diameter, highly myelinated motor neuron, right, to skeletal muscle. The autonomic nervous system is a two neuron chain. The first neuron is referred to as the preganglionic neuron. Sometimes I'll just refer to it as neuron 1, that is lightly myelinated. And then you have the second neuron, the postganglionic neuron, or maybe neuron 2, that in the autonomic ganglion that has unmyelinated postganglionic axon that extends to the effector. I'm not so concerned that you understand the degree of myelination. It's just a way that they compare and contrast, some of the differences between the somatic and the autonomic nervous system. Most importantly, single neuron in the somatic division, two neuron chain in the autonomic nervous system. But then we get to the neurotransmitters and their effects, right? And so this is where you start to have, more differentiation, not only the neurotransmitters, but the receptors. We looked at the somatic division. We said that when we looked at the neuromuscular junction, that when we want to excite that skeletal muscle, we're going to be releasing acetylcholine, and thus it'll bind to acetylcholine receptor. And it's always stimulatory. But in the autonomic nervous system, there's some differentiation. Now, between the sympathetic and parasympathetics, we're going to compare and contrast them individually. All the preganglionics do release acetylcholine. And the postganglionics, the second neuron, will either release norepinephrine or acetylcholine, depending on whether we're talking about the sympathetic division that uses norepinephrine or the parasympathetic division that will continue to use acetylcholine. The effect is either stimulatory or inhibitory to its effector. It depends on the receptor types. So this has to do with understanding which organs are stimulated and inhibited when we're in parasympathetic stimulation, and then the reverse, which organs when we're in fight or flight mode will be stimulated and which ones will be inhibited. So this is a fantastic diagram. We have the parasympathetic on the left side and the sympathetic to the right. And as you break this down and you look at it, it's really telling you all kinds of information about these two systems. First of all, let's look at the parasympathetic division. The first neurons are here in kind of a purple. They are exiting from the cranial region. You see the purple, dark blue dots, which represent the nuclei. And then they also leave the sacrum. So it's called a craniosacral outflow. Two neuron chain. The first neuron is long. And if we just look at the one that goes to the pupils, the first neuron is long. And where you have the little Y ending, the branch at the end of the neuron, that represents the synapse. And so the first neuron is long, you synapse, the second neuron is short, and then it terminates on its target organ. In this case, it's going to be some of the muscles of the pupil. And so that is characteristic about the parasympathetic division. Has what's called craniosacral outflow. First neuron is long, second one's short. Then we look at the responses. So it tells you, it constricts the pupil. It is excitatory, that is considered excitatory because this muscle is contracting, but it's the circular internal layer of muscles that causes that pupil to constrict. And we'll look at that more when we get to the special senses. Increases salivation, lacrimation, and urination. We're going to look at an acronym SLED to identify the systems that are increased in parasympathetic stimulation. Down below that, it says decreases respiration rate, right? Because when you are in rest and digest, you don't need to be breathing heavily. And below that, decrease heart rate, because we don't need to have our heart beating fast when we're resting. Dilates the blood vessels to a lot of them, not necessarily everyone, but what they're trying to do is say, hey, if we relax the walls of those blood vessels, we're going to decrease our blood pressure, because we don't need to have high blood pressure. We just need to have normal blood pressure. Stimulates digestive processes. So the stomach, the gallbladder, the liver, any of these organs associated with digestion, that we looked at in the first section in lab, these different organs and what cavity they were found in, and what system were they associated with. The systems associated with digestion and urination are all going to be accelerated or stimulated. To the right-hand side, I was going to say left, to the right-hand side, we have the sympathetic division. Now look where those neurons are originating. They're originating from the thoracolumbar region. Right, the first neuron is short and synapses in that. It's called the paravertebral chain. Those yellow kind of dots that are all connected to one another. So generally, its first neuron is short and its second one is long, in contrast to parasympathetic. And then look at its responses. It's going to be the opposite of what this parasympathetic division is doing. In the sympathetic division, it's going to dilate the pupil. Now, that is still excitatory to that muscle. They're going to be what's called radial muscles that when they contract, they pull open like it's spokes of a wheel, or those, can I lick your eye? The canaliculus, right? They radiate outwards. So when those muscles contract, it pulls open the pupil, and thus it pupillary dilates. It decreases salivation, increases respiratory rate and heart rate. Right? It constricts the blood vessels, attempting to increase blood pressure. It inhibits digestive processes, right, and relaxes the bladder so you don't urinate. And it inhibits defecation. So the systems that we stimulate and excite mostly, in the parasympathetic division will be inhibited in the sympathetic division and vice versa, because we have those organs that are associated more with rest and digest functions than in the sympathetic nervous system, fight or flight. In fight or flight, you're going to eventually put together these responses that all need to occur. And once you get that and you start grouping those together, then you're going to have a better understanding of nursing application and things like that, patient assessment, what you're looking at when you're looking at a patient. All right. So here, this is just a diagram that shows the somatic division on top, one motor neuron, heavily myelinated. The next to that, we have a column for the neurotransmitter, and the effect. And here we have the effector organ, or I should say neurotransmitter at effector. And then we have the effect over to the right-hand side. All right, so the somatic division releases acetylcholine, as you know, target skeletal muscle, always excitatory. If we want to inhibit it, we're going to use a different neurotransmitter, but we're just looking at the excitatory functions to skeletal muscle. Then below that, we see some diagrams for the autonomic nervous system, sympathetic division and the parasympathetic division. Okay. So let's look at the sympathetic first. It's a little more complicated, but then we get it out of the way. All right, first neuron is short, second one's long. All right, so let's look at that top two neuron chain. It releases acetylcholine between neuron 1 or the preganglionic and the postganglionic. And the effect on that second neuron at that first synapse is always going to be excitatory. And we're going to look at exactly what kind of receptor is found there, muscarinic or nicotinic. Right, then an impulse travels down the second neuron, and now it releases norepinephrine. Now we have a new neurotransmitter. Right, so its effectors can be all those organs that we just identified in that other chart that showed you the targets or the effectors of parasympathetic and sympathetic. If they are associated with rest and digest, the effect is going to be a negative, inhibitory. If it's to respiratory rates, the heart rate, the blood vessels to constrict and start to increase blood pressure, then we're going to have an excitatory effect. Below that in the sympathetic division shows you another preganglionic neuron that's targeting on this weird looking thing, and that's your adrenal gland. And this is what makes the sympathetic division, again, very different from the parasympathetic division, is that one or two of these neurons are going to travel to what's called the adrenal medulla. And the medulla is the internal region of this gland. The cortex is the outer portion. The medulla is the inner portion. And from there, that inner portion, the medulla, secretes epinephrine and norepinephrine into a blood vessel. And that now becomes part of what's called the endocrine system. When we use chemical compounds, we put it in blood, and as the heart beats, boom, 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 it delivers this epinephrine and norepinephrine, which act as hormones to target particular organs. Right? And thus, again, will have either an excitatory or inhibitory effect, depending on what those organs should do. It's going to excite the heart. It's going to excite blood vessels to vasoconstrict. Technically, what we're going to do is we're going to shunt blood from some areas to the others. When we're in rest and digest mode, and I know this sounds complicated, but try to just kind of wrap your head around this. When you're resting, you want to send the most blood to your digestive organs because you're breaking down molecules and you're absorbing them, and you need to transport them to the organs that need to use these different molecules, all these different building blocks that you broke down from your chemistry chapter. You're also forming urine, and might be a good time to evacuate your bowels or to micturate, to urinate. So some organs are going to be, we're going to deliver more blood to those regions, and maybe not so much to skeletal muscle because they're not working, they're just relaxing, or most of them anyway. Not so much to the lungs, so we want to vasodilate the blood vessels that we want to encourage blood flow to, and vasoconstrict and narrow it down and decrease the flow to areas of the body that we don't really need to be sending a lot of blood to at this point. It's the way we control where blood is circulating. In the sympathetic division, it's going to do that. And that's going to be some of the differences between epinephrine and norepinephrine. I don't hold you to exactly which one is different, that you just understand that now when you're in sympathetic mode, and maybe you're in fight or flight, is that now we're going to vasoconstrict and limit, not completely, but it discourage maximum blood flow to the digestive organs and to the kidneys and things, to forming urine, and more so to skeletal muscles that need to work because you need to run like hell for 3 minutes, 5 minutes, to the lungs, increase heart rate, deliver more blood to the brain and so forth, to those areas. So we can, route blood to the areas we want it to go and discourage maximum flow to the areas we don't need it to go right now. All right, so that's the sympathetic. The parasympathetic below that in blue, the first neuron is long, the second one's short. So between the neuron 1 and neuron 2 are the preganglionic and the postganglionic neurons. We're secreting acetylcholine, just like we've seen before. And the response to that postganglionic neuron, or neuron 2, is excitatory. Now it transports an action potential to the axon terminal, and now we release acetylcholine again. The effect on the target organ of the effector, it just depends. Is it supposed to excite it or inhibit it? If it's part of salivation, lacrimation, urination, digestion, defecation, we're going to excite it. If it's not part of that, we're going to inhibit it. Not completely, but we're going to slow it down, like slowing down the heart rate. So we're primarily, again, using a lot of acetylcholine, with the exception of the second neuron in sympathetic division releasing norepinephrine, and then the norepinephrine and epinephrine that gets pumped into the cardiovascular system. All right, so here's a little chart that compares the autonomic nervous system with the somatic division and compares the sensory neurons, the same. Association or interneurons, the same. Right, autonomic nervous system, motor neurons, 2-neuron chain, preganglionics, all, the first nerve, all secrete acetylcholine, and the postganglionics, they may secrete acetylcholine if it's the parasympathetic division, or norepinephrine if it's the sympathetic division. The somatic division only releases acetylcholine for all intents and purposes right now. And then the effectors, well, the effectors of the autonomic nervous system are cardiac muscle, smooth muscle, and glands, and somatic division, skeletal muscle only. Okay, so now we're going to compare and contrast sympathetic and parasympathetic division. Right. Dual innervation, almost all visceral organs are served by both divisions, but they cause opposite effects. So what does that mean? It means that for virtually all your visceral organs, you have sympathetic fibers terminating on it and parasympathetic fibers. And that's how that organ knows, do I want to speed up or slow down? Are you releasing acetylcholine on my surface to bind to a receptor, or are you releasing norepinephrine? Or maybe epinephrine and norepinephrine cardiovascular system. What do you want me to do? Because that's how your organs know. They all respond chemically. So the parasympathetic divisions, the nerves emerge from the craniosacral regions. That's important to know. And we will identify exactly which cranial nerves are associated with that. You have the first neuron, or the preganglionic neurons, are long, and the second ones, or the postganglionics, are short, as indicated in that image. The neurotransmitters, acetylcholine throughout. Does not matter, it uses acetylcholine throughout the entire pathway. Has localized effects because it's not going to use hormones, into the bloodstream. Only the sympathetic division does. Its physiological effects are rest and digest. SLUD will serve you very well. These are the things that are increased in parasympathetic stimulation: salivation, lacrimation, urination, digestion, defecation. So things like the salivary glands, are part of, digestion. So salivation. Lacrimation is tear production, producing urine and urination and defecation, as well as digestive functions. Those will all be stimulated. 3 things or structures it decreases in opposition will be heart rate, airway constriction, and pupils. Right? It slows down heart rate. It slows down respiratory rates. It will bronchoconstrict, it's called, because you don't need to have all these tubes and hobes wide open for air to be traveling through there. It's going to let those muscles relax and constrict, and just allow a normal amount of air into and out of the lungs. And it pupillary constricts. The cranial nerves of the cranial division are cranial nerves 3, 7, 9, and 10. Cell bodies are in the brainstem, preganglionic fibers to an oculomotor nerve, facial, glossopharyngeal, and vagus. So now, when you go back and you look at some of those cranial nerve functions, now you see what we're talking about with those, that they can cause pupillary constriction, increased salivation, the parotid glands, the sublingual, submandibulars, lacrimal glands, slowing down heart rate, like vagus. 3, 7, 9, and 10. I would maybe make a flashcard for that. The sacral part of the parasympathetic division, just in mentioning, I don't really ask a lot of, I don't think I ask any questions about this other than you do have nerves from the sacral division, but nerves serves, the sacral division serves the pelvic organs in the distal half of the large intestine. They are nerves from the S2, S4 regions of the sacrum, so forth and so on. But they, especially down the bottom, the ganglia in the walls of distal half of the large intestine, urinary bladder, ureters, and reproductive organs. So all those organs associated with digestion, urination, and even reproduction. All right, so this next image shows you only 3 out of the 4 cranial nerves, but there's another one that is a better picture, but it shows you that, these are going to supply the eyes, salivary glands, vagus nerve to the heart, lungs, stomach, and the different responses, heart rate decrease, lungs and bronchoconstriction, decrease, stomach increase, pancreas increase, all your digestive organs increase. This too shows you, now this is better to show you the cranial nerves, 3, 7, 9, and 10. So it shows you cranial nerve 3 travels to the eye. That's pupillary constriction. 7, ultimately to the lacrimal glands and some of the nasal mucosa. We have glossopharyngeal to some of the submandibulars and sublingual glands. Those are, you'll see those when we look at the digestive system in ANP2, but we have not only the parotid gland that is superficial to your temporomandibular joint, we see it by the masseter muscle there, but we have salivary glands that are smaller under the tongue called sublinguals and kind of inferior to the mandible called submandibular. And they're associated with digestion as well. And then we have the parotid gland below that. But then we can see, we have remember, vagus is the only nerve that conveys both sensory and motor below the shoulders in the thoracic and abdominal cavities. So vagus has a lot of territory to cover, all those organs in the abdominal pelvic cavity. All right, the sympathetic division, the nerves emerge from the thoracolumbar region, or what's called thoracolumbar outflow. Okay. The first neuron is short, the second one is long. First neuron is short, second one's long. Neurotransmitters. Well, the first neuron at the first synapse is going to secrete acetylcholine. So I write in there, just like the parasympathetic division, the postganglionic neuron, this is where we change. It's going to be norepinephrine. There is one exception, and I won't ask you about it, but sweat glands. You will then also release acetylcholine in the parasympathetic division to stimulate the sweat glands. But everything else is norepinephrine. I won't ask you about that little exception. Now, the effects. The sympathetic system is far more widespread. This is because you need to respond within milliseconds, right? This is about survival. These are all the physiological changes that need to occur to allow you to see everything that's coming close to you, wake you up, allow you to run like hell for 3 to 5 minutes and survive. The physiological effects are fight or flight, and these are the things that are increased, or the situations that are stimulated or cause stimulation: exercise, emergency, excitement, or embarrassment. The E situations. Remember that one of these pathways, these neurons, is going to travel directly to the adrenal medulla. So there's some preganglionic fibers pass directly to the adrenal medulla without synapsing. And upon stimulation, the adrenal medulla secretes norepinephrine and epinephrine into the blood. And now those chemicals, although they're similar, is that they're going to be part of what's called the endocrine system. Whenever chemical compounds get put into the cardiovascular system to target an organ, it becomes part of the endocrine system. But we'll look at that again in ANP2. But this is how you're going to cause, the sympathetic nervous system is only going to affect those organs that has a nerve fiber terminating on that has a receptor to acetylcholine. Sympathetic system uses the bloodstream, and now you can affect the internal walls of all these different blood vessels, inhibit them to allow them to vasodilate, stimulate them to vasoconstrict, increase blood pressure. We can route blood that way. We will reroute blood that way. We can affect areas of the brain to wake up, but we need to have systemic, like massive changes occur rapidly. We're not in rest and digest, and whenever you get there, you get there. This has to happen right away. So we not only amplify the response, by targeting multiple organs because we're using the bloodstream now, but how quickly you can respond. Here we can see the thoracolumbar outflow. First neuron is short, second one is long. Again, to the eyes, the skin, so forth and so on. This compares and contrasts this chart, the difference between parasympathetic and sympathetic as to origin, craniosacral versus thoracolumbar. Fibers, preganglionic or neuron 1 is long, second one is short in the parasympathetic division. In the sympathetic, the first neuron or preganglionic is short and the second one is long. Neurotransmitters used, parasympathetic acetylcholine throughout. Sympathetic division, acetylcholine at the first synapse, norepinephrine at the second synapse. The distance they work, or how much territory do they cover? Parasympathetic has only localized effects. Sympathetic division, widespread effects. And your physiological effects. Parasympathetic is rest and digest. The systems that are accelerated or stimulated are your salivation, lacrimation, urination, digestion, defecation, or SLED. And the sympathetic system is associated with fight or flight, physiological responses, and your E situations. Okay, so first you start with just understanding that which I just compared and contrast. Look at those pictures, maybe draw a few of these out. That's generally what we would do in a face-to-face environment. I think I have perhaps something in my office that I can upload to the course page that is drawn out that will identify, kind of take a lot of this and put it in not necessarily one diagram, but sort of one diagram, comparing parasympathetic and sympathetic divisions, comparing the length of neuron 1 and neuron 2, the neurotransmitter released, eventually in this case, the receptors and their responses, and then between at the first synapse, and then the effectors and their responses in the parasympathetic versus sympathetic division. So I'll see if I can find that and then upload it. Okay, so now we need to look at, so we've identified where these fibers are coming from, where, compare and contrast that, their neurotransmitters and the effects of the organs when we're stimulating sympathetic versus parasympathetic divisions. But now we need to look at the receptors, because this now starts getting into real nurse medical stuff that's going to help you later on. All right, so we're going to talk about the difference between some of the terms for receptors for acetylcholine and norepinephrine and epinephrine. Cholinergic receptors respond to acetylcholine. Right? They're inactivated or degraded by acetylcholinesterase. And we have two types of receptors, nicotinic and muscarinic receptors. And we're going to talk about those in just a minute. But acetylcholine, cholinergic receptors, two classes, nicotinic and muscarinic, are two completely different types. When it comes to norepinephrine and epinephrine, those are called adrenergic receptors. Those are adrenergic receptors. They are broken down or inactivated by MAOs and COMTs. MAO on the bottom means monoamine oxidase, and COMT means catechol-methyltransferase. That's why we use the acronym frequently. And there are two types of receptors, alpha receptors and beta receptors. Now, we will even have sub-classifications to the alphas and the betas. We have alpha 1s, alpha 2s, and beta 1s, beta 2s, and beta 3s. But these are generally anything with alpha in the title or beta in the title. They're the adrenergics. They are capable of binding to norepinephrine or epinephrine. Okay, so let's talk about nicotinics. Nicotinic receptors are on the second neurons at the first synapse between neuron 1 to neuron 2, pre to postganglionic neuron. Your first synapse area. And this is for sympathetic and parasympathetic divisions. That the receptor on that postganglionic neuron is going to be a nicotinic receptor. And when acetylcholine binds to that, it's always excitatory. Always excitatory. Muscarinic receptors are found on the effectors in the parasympathetic division. Remember, because the sympathetic division is going to use epinephrine and norepinephrine. So now we're going, okay, we have the first synapse. Now we have an impulse traveling down the second neuron or the postganglionic neuron, and it's terminating on these organs. on the organ or the effector will be muscarinic receptors, right? Different classification. Nicotinic receptors, their behavior, when acetylcholine binds to it, will never change. It's always excitatory. Muscarinic receptors, we have two subclasses to them. So if acetylcholine binds to one class, it will inhibit that organ. And thus, organs that need to be inhibited will have the particular muscarinic subclass kind of receptor that when acetylcholine binds to it, you inhibit that organ. And the opposite to those organs that you need to stimulate. When acetylcholine binds to the other class of muscarinic receptor, it excites that organ. That's how, the heart knows what to do compared to the stomach. One is going to be inhibited, one's going to be excited when acetylcholine binds to it. Adrenergic receptors, we have more variability. We have alpha receptors and beta receptors. We have alpha 1s and 2s, and we have beta 1s, 2s, and 3s. Right, so this is the deal generally. Things ending in 1, if you have an alpha 1 or a beta 1 receptor, they are generally 99% of the time have an excitatory effect on that organ. Right, so beta 1s are going to be the kind that we find on the heart to increase heart rate, things like that. Always beta 1s. If they end in 2, an alpha 2 or a beta 2, the effect is generally inhibitory. And beta 3s are excitatory, and they're associated with thermogenesis. I generally don't ask you questions about beta 3s, really just about the alpha 1, beta 1s, and the alpha 2s and the beta 2s. So our body contains two different types of alpha receptors, known as alpha 1s and alpha 2s. Alpha 1 receptors are generally excitatory, as are beta 1s. But we're going to now just look at the alphas and look at the betas and then kind of put them together. Located in on virtually all sympathetic organs and radial muscles of the pupil. To stimulate them, the radial muscles will contract and dilate the pupil and open that up. It will constrict blood vessels to the skin and digestive organs. That's how we're going to cut down on the blood flow there. And they're excitatory to constrict visceral organ sphincters. So what does that mean? It means that the sphincters, at certain areas of the digestive system and the urinary system will constrict. And so you don't allow fluid or material to pass through. Alpha 2 receptors are generally inhibitory. They inhibit insulin release from the pancreas. This will become more relevant when we get into the autonomic nervous system, the endocrine system, of AMP2, when we're looking at, how we regulate blood glucose levels, but when we're in sympathetic mode, remember, this is all about sympathetic mode and running like hell, is that we will inhibit insulin release. We're going to leave that glucose out there, to be available to be taken in by skeletal muscle. All right, then we're going to go to the betas. Our body contains three different types of beta receptors: beta 1s, beta 2s, beta 3s. Beta 1 receptors, generally excitatory, predominantly located in the heart to increase heart rate, and the kidneys to release renin, a profound vasoconstrictor. Right, so again, we will look at renin more when it comes to AMP2, but I would keep these notes so you can refer back to them when we get to AMP2. Many people don't, and they lose kind of track of what was all that about beta 1s and beta 2s, because now I understand how renin will be released, how we're going to use the kidneys, to release this enzyme /hormone, to cause vasoconstriction and have increased blood pressure. Beta 2 receptors are generally inhibitory, located in the lungs to inhibit the smooth muscles of bronchioles and thus dilate them, and dilate blood vessels to skeletal muscles, the heart, and the liver to increase blood delivery. Right. So let me try to explain what's going to happen here. And again, this will make more sense when we get into AMP2. But we have layers of circular muscle, that surround certain areas of your airflow respiratory pathway into your lungs, and also, the blood vessels. If we want something to dilate, if we want it to become larger in diameter, in the case of the lungs, to let more air in and out, We will inhibit those muscles and allow them to relax and slowly open up the size of the tube. If we want to, to constrict those areas, then I'll stimulate those muscles so they close down and produce like a narrow little straw, so to speak, of airway flow. If I want a large pipe, to allow air into and out of the lungs, which you're going to want to do, then I inhibit those muscles and let them expand and dilate. So even though we're bronchodilating, that seems to be like an excitatory, effect, it actually is inhibitory to those muscles so that you can dilate. Dilates to blood vessels. So the same thing. We're going to have kind of fewer, it's called fewer impulses traveling down the sympathetic nervous system to blood vessels to allow them to relax a little bit and allow the lumen of that blood vessel to widen and become larger and let more blood pass through it. It's going to relax the smooth muscle of the gastrointestinal tract for the opposite reason. We want to slow down gut motility. We want to slow down food transiting through the digestive system because, when we break down food, we want to maximally absorb whatever we can. We don't want it to be shooting through there. And if we're going to redirect blood and discourage blood to travel to that area and encourage it to skeletal muscles, the heart, the lungs, the brain, then, we're going to slow down the movement of fluid through the small intestine until later when we can fully send more blood to the area so we can absorb and transport all those molecules that we have working so hard to break down to the building block forms of all those organic molecules that we learned in chemistry, and transport them to organs. So we're going to slow down, the digestive system, and the uterus, to decrease movement through that tube. Beta-3 receptors are found in fat cells of the body to stimulate lipolysis, which means we start breaking down fat, maybe making some of that available as an energy source as well. But, that's kind of like an FYI. Definitely, I would know beta receptors, primarily the heart, predominates in the heart, increase. That's why we have beta blockers when we want to slow down heart rate as a method of decreasing blood pressure. And it'll block renin so that we stop vasoconstricting and increasing blood pressure. And then beta-2 receptors are inhibitory, and inhibits the smooth muscles of the bronchioles, thus dilates them and lets more air into the lungs, dilates blood vessels to skeletal muscles in the heart, because that's where it's needed. The liver to increase blood delivery, absolutely, and relaxes the smooth muscle. See how it works in inhibitory fashion to the gastrointestinal tract, slow down digestion. Okay, so I think this is kind of handy to look at. Here we have on top, we have acetylcholine neurotransmitter versus norepinephrine, epinephrine below. So the top in the lighter tan is parasympathetic division, mostly, nicotinic and muscarinic receptors. Let me just go back and just say nicotinic receptors are going to be part of the sympathetic nervous system as well, but the muscarinics will only be parasympathetic. So it says nicotinic major locations. Postganglionic neurons, you can pretty much just stop there. It's between neuron 1 to neuron 2, and the effect is always excitatory. Muscarinic receptors are found on all parasympathetic target organs, and limited sympathetic targets. So don't even worry about those, because that's the sweat gland that we are going to stimulate in the sympathetic division. And its effect on all parasympathetic organs, excitation in most cases, inhibition in cardiac muscle, or inhibition to other organs. All right, then we look at epinephrine and norepinephrine, your beta 1s, beta 2s, beta 3s, and alpha 1s and alpha 2s. So you can read that on your own. It really is the notes that I gave you organized it in such a way that is essentially this information, but looking at, the alphas, 1s and 2s, and then the beta 1s, 2s, and 3s. The previous slide that groups together essentially anything ending in 1, beta 1s and alpha 1s, have an excitatory effect on their target organs. And when they end in 2, they have an inhibitory effect on the target organ. And inhibiting a muscle so it can relax and open up an airway pathway or allow vasodilation is in inhibition to that target. The response is to, hey, it allows more air in and out, or allows more blood flow through that blood vessel. Okay, so you can look at those. And then here we're comparing again, these charts are very handy. So you might want to, if you're not as good as at, reading through the notes and identifying those different functions and comparing and contrast, try drawing out these charts. So we have the division, sympathetic and parasympathetic. We have the postganglionic receptor, the effector receptor, and then excitatory or inhibitory. Which receptors are excitatory or inhibitory? So sympathetic nervous system, the postganglionic receptor. We are releasing acetylcholine, so the receptor is nicotinic and it's always excitatory. That's the plus. Then we release norepinephrine at the second neuron or the postganglionic neuron to the effector organ. We release norepinephrine and the receptor. If it's an alpha receptor, we have two classes. We have an alpha 1 and an alpha 2 going straight across from left to right. If it's excitatory response, or if you have an alpha 1, it's excitatory. If you have an alpha 2 receptor binding to norepinephrine, it's inhibitory response. Below that, we have, okay, well, that's the alphas. Let's look at the betas. If the second neuron is releasing norepinephrine, it's a beta receptor. We have subclasses 1, 2, and 3. If it's a beta 1, the response is excitatory. If it's a beta 2, it's going to be inhibitory. Parasympathetic division, postganglionic, what's the receptor on, at that first synapse on the postganglionic neuron? It's a nicotinic and it's always excitatory when acetylcholine binds to it. When it comes to the target organ in the parasympathetic division, we release acetylcholine and those receptors are muscarinics. They might be the excitatory one or the inhibitory one. It just depends on the organ. So all the SLUD, maybe here under excitatory, write SLUD in there. So those are all the systems that are excited. And inhibited would be the heart, respiratory rates. Okay. One of my dogs is sleeping and dreaming, and his feet are moving, and the other dog is hearing him and going over there going, what's the matter with you? Leave him alone, let him sleep. Okay, sorry about that. Okay, what do we mean by sympathetic tone and parasympathetic tone? All right, sympathetic tone, the sympathetic division controls blood pressure even at rest. So we come back to this in ANP2. The degree of vasoconstriction and dilation in the blood vessels is really controlled by the sympathetic division, the sympathetic nervous system. You either send many signals like you would maybe to skeletal muscles to get something to contract. You'll send many signals down these pathways to the blood vessels to stimulate them to vasoconstrict if you want to decrease blood flow through there or maybe increase your blood pressure. If we want them to essentially to decrease blood pressure or maybe increase blood flow to an area, we'll send fewer signals down that pathway to allow those muscles not to relax entirely, because then the blood vessel would just balloon out, but to relax some and let it increase in diameter. All right, so sympathetic tone or vasomotor tone keeps the blood vessels at a continual state of partial constriction, similar to muscle tone. We can either contract them as forcefully as we want or let them relax a little bit and just have a certain amount of muscle contraction in there. Not so much that you would have an aneurysm and as blood passes through there, break through the wall of that artery, but let it dilate and let the lumen become larger. Sympathetic fibers fire more rapidly to constrict blood vessels and cause blood pressure to rise or decrease, blood flow to an organ. Or sympathetic fibers can fire less rapidly and thus prompt vessels to dilate, decrease the pressure, and increase the amount of blood that can pass through there. Parasympathetic tone normally dominates the heart, right? So, what we're going to learn about the heart in ANP2, and even mentioned it when we looked at, compared and contrasted the different muscle tissues in the muscle system. is that cardiac muscle has what's called autorhythmicity, which means that even if we never stimulate it to contract, it's going to generate impulses to contract, at about 100 beats per minute if it's originating from the SA node. From the AV node, it's like 40 to 60 beats per minute. And from the Purkinje's, it's about 20 beats per minute. So we don't need to be beating at 100 beats per minute, when we're resting like this. So what do? We are riding the brake on the heart all the time. The parasympathetic division is going to continually, that's what I call it, riding the brake. It's going to inhibit the heart to conserve all that energy in the tissue. So the parasympathetic division normally dominates the heart and smooth muscles of the digestive and the urinary tracts as well. It slows down heart rate. It dictates normal activity levels of the digestive and the urinary tracts. The sympathetic division can override these effects during stress, as we know, because then we will increase heart rate, decrease, inhibit gut motility and urine formation, when we need to be in fight or flight mode. So that's important to understand. Parasympathetic division, vagus nerve rides the heart and conserves its energy, slows it down. Its effect is inhibitory to slow down heart rate, because otherwise it'll run, be like a runaway train going downhill, and there's no brake system. And so you need to ride the brake all the time. Drugs that block parasympathetic responses increase heart rate and block fecal and urinary retention. So that will come back later once you get into your nursing program or PA program, whatever you're interested in. Right, localized versus diffuse effects. We talked about that. Parasympathetic is very short-lived, highly localized control over its effectors. So it doesn't have widespread effects, but the sympathetic division does. It's longer lasting and it has body-wide systemic effects, because we're going to use epinephrine and norepinephrine into the bloodstream, and now it can target massive amounts of target tissues, because you're increasing heart rate and now you're pumping that blood all over. The hypothalamus is the main integrative center of autonomic nervous system activity. It's also going to be the controller of the endocrine system as well, amongst other things. It's also subconscious cerebral input via the limbic area, can influence the hypothalamic function. It can cause you to start hyperventilating when you're scared or you're upset about something, let's say. And other controls come from the cerebral cortex, the reticular formation, and the spinal cord. But what I want you to know is really there in a minute. Okay, and that is the end of the autonomic nervous system.